Hi, my name is Janelle. I'm a third-year nursing student at the University of Victoria, attending Selkirk College in Castlegar, BC. I'm going to do a nursing informatics on the Sigma Spectrum infusion pump. For demonstration, we have a primed IV line. And one tip that I've found is you want to ensure that you have the blue clamp and the roller with enough distance in between. We're going to insert the blue clamp into the top of the pump where it says number 1. This will activate and open up the door. We're going to insert the tubing by running our finger along the tube, and it will get check marks ensuring that they're in place to number 3 and 4. At this time, we can close the door. It's now asking what care area we're working in. Using the down arrow, we can select the area of care. For this demonstration, we're going to use the med surge and press OK. It's now asking the drug name. This program recognizes generic names, not trade names. And we're going to infuse normal saline, which is not in this program also. So we want to enter in IV fluids. So entering in the numbers, we need to press for I, we need to press 3 times. And then the V just once. We'll get the list. Using the down arrow, we'll go to IV fluids and press OK. So we have our IV fluid for our primary bag. We're going to enter in the rate as per doctor's orders. So for demonstration, we'll enter in 100, pressing OK. If we were to enter the down arrow, it would not save this information. So the volume to be infused, we're using a 500 milliliter bag and pressing OK. This automatically calculates the time. So the normal saline is going to infuse over 5 hours. So we need to open up the slide clamp. And we have to ensure that the roller clamp is open. And we want to press run. This is a safety check. They want to ensure that all clamps are open. The blue clamp, the roller clamp, the tubing's not kinked, and to ensure that drops are flowing from the drip chamber. So at this time we'll press yes. And the primary is infusing with IV fluid at 100 milliliters. Now that we have our primary line infusing, we're going to add a secondary bag. And so prior to doing this medication, we're going to do our 9 rites of medication administration 3 times. And we're going to check the medication manual on the Interior Health iSite to ensure that we have the right preparation for the ANSEF. So to program the secondary bag into the infusion pump, we're going to run stop. On the bottom here, it says review program. So we'll press that one. Same with the bottom here. It says program secondary. We'll press this button. Now it's asking for the drug name. So we'll add cefalozone, and to get the letters, we'll press C 3 times and E 2 times. The list of drugs will come up. We're going to use the down arrow, pressing, and I've selected my drug, press OK. It's asking if I want cefazolin, so I have the correct drug. It's infusing in my secondary bag, and I'll press OK. So as per the manual, I've looked up the drug, and I'm going to have the rate for the demonstration of 200, pressing OK. And then the volume to be infused, I have it in a 100 ml bag, and pressing OK. So this is where I can do my checks, and it's asking for a secondary callback. This is going to be unique for each patient, and so if you need to come back and ensure that the primary line is still infusing, or if you need to disconnect the IV altogether, you can press yes. So for the secondary bag, the rate is 200, and we're going to run this. Opening up the clamps, we'll press run, and it's asking if the drops are falling from the secondary chamber, which they are, so I'll press yes. So the secondary bag is infusing. The drug is cefalozone at 200 mils. And if I want to double check, I can press review, and I can see everything that I've entered in. The rate, the volume to be infused, and the time. So that our secondary bag will infuse over 30 minutes, and we'll get a call back at the end. So one troubleshooting that I'll go over is downward occlusion. So if the clamp is closed off, the pump will recognize this. So it's saying downward occlusion. So the pump has recognized that it's not infusing. So you want to go from the patient and checking the line, ensuring that the clamps are open. So this one's open, this blue slider clamp is open, and we've opened up the secondary clamp. Now our secondary bag is infusing again, and everything is fine. If you find that the downward occlusion continues on, you'll want to check the patient's IV site to ensure that it's patent. So I hope that my example using the infusion pump has been helpful, and thanks for watching.